Okay, so how do we adjust our care to meet the developmental needs of children? There are several basic principles that we'll talk about, and then we apply those debate based on the developmental stage of that child. So first is family-centered care. When you're caring for a child, your child is not your only patient. The child is the patient, but the family is involved in that care. We're used to, in adult care, we take care of the patient, we're responsible to that patient, and sometimes even helping them or protecting their boundaries with family members. And we still have to do that to an extent with children, especially older kids. There may be some confidentiality guidelines for older kids, but we really have to involve the parents in the care. The parents are part of that care. Another is atraumatic care. We want the things that we want our interventions to cause as little pain and trauma to that child as possible. So we want to try to minimize the fear and anxiety, and we want to minimize the pain of interventions. Children can actually suffer PTSD from medical treatment. So we need to make sure that we're minimizing that trauma. We develop a therapeutic relationship with the child and also with the parents. And our relationship with the child may be different from our relationship with the parents, but we need to have a relationship in order to work with that child. Family advocacy may be a piece of that. We may be advocating for our families to have their needs met. We may be advocating for our patient within the family. We focus a lot on health promotion. We see healthy children a lot more than we see healthy adults, especially in the outpatient setting, because the goal is to try to promote health, help them grow up healthy, and identify problems early. So health promotion tends to be a bigger focus. Anticipatory guidance is helping the family know what to expect next developmentally, what's going to happen next, what can I do to promote that development for my child. Safety is always paramount, and safety should be based on the developmental stage of the inabilities of the child. There are some ethical considerations when we're caring for children. Typically, parents or legal guardians give consent for treatment for children. Okay, that's pretty standard. But there are some areas in which older children consent for themselves and have the right to privacy. And that's going to be reproductive related care. And that includes contraception and STI treatment and testing and drug treatment. So you need to make sure that you know your state laws in that area and what your legal responsibilities are. In addition to that, there are some other ethical dilemmas. Sometimes parents are making decisions that we feel are not in the best interest of their child or are not safe for their child. And so then ethically, we have to determine, is this just a people parent differently issue, or is this a real safety issue for this child? There's a lot of space between abuse and not the way I would do it. And we need to make sure that we understand the difference there. We are mandated reporters for suspected abuse. We don't need to wait to confirm the abuse, but we also need to be cautious of reporting parenting differences that are not abusive as abuse. And then there are the medical decisions. When parents are making medical decisions, sometimes based on a belief system that the child hasn't had the opportunity to determine if they agree or not. So things like vaccination, blood transfusions, the parent making health decisions based on that belief system, there's some potential ethical dilemma for us there. That dilemma is greater if there's a risk of death because of those decisions. And also, as kids get older, there may be questions that they have for healthcare professionals, or there may be things they share with us that they don't want their parents to be aware of. And so we have an ethical decision point there as well. And typically the most ethical decision there is to keep the child's confidence unless it's a safety issue. If it's an issue where the child is in danger, then we need to be honest with them that we have to inform their parents. We need to inform their parents or guardians, someone who is able to protect them. In caring for adults, we take care of adults with different temperaments, right? Well, sometimes we don't treat kids like full people, and we don't take into account that kids have different temperaments. There are kids who like new things, that novelty. They want to always be learning and seeing something new. They get bored of things stay the same too much. Sorry, they get bored of things stay the same too much. There also are kids who are very, very anxious about any change. That's a personality difference. And so we need to understand that we're dealing with actual humans who have their own unique temperament and personality, and adjust our care for that. And then, of course, we need to address the child's developmental stage. Where are they in that development? So we're going to get to some more specifics about this in the next section.